our candidates to attend the session because we're starting right now. So we can start quick. Please, guys, if you see me online on the Facebook, please let me know.
Adam, can somebody tag me on this Facebook Live session so that I can see it immediately right now?
Okay, give me 1 second, please. Okay, guys, I believe you are on. We are live on the Facebook. I can see right now. I believe you are on. We are live on the Facebook. I can see right now. Okay, guys, I'm not quite sure if there is echo or not. Please, guys, let me know if there is echo, please. So, Dr. Alifiya, are you there?
Yes, Dr. Adam, I'm here. And I can see the live session now on Facebook.
Okay, are you ready to start right now?
Yep, I'm ready to start. If everyone's ready
Okay,
and
thank
we
you.
have everyone on.
Yeah, sorry, your voice is still breaking.
I don't think so, Dr. Adam. I think it's only from your side.
It is from my side, but still breaking for me.
Okay.
So I cannot hear you. I don't know exactly what you say.
That's okay. I'm going to start the session soon now. Okay.
That's okay then. Okay, guys, for a start, we would love to check on every one of you guys. How you doing? Hi, Dr. Natalie. How you going? By the way, guys, we going to finish this infection control session because maybe we have one more time, infection control. So this session will be finishing in an hour. And then from 8 o'clock or 8:15 max, I will be starting my class. Okay, guys? Thank you. Hi, Dr. Natalie. How you going? Dr. Lev, how you going? Thank you very much. Dr. Sida, how you going? Dr. Kanika, Dr. Taslim, Dr. Catherine, how you going? Dr. Alifiya, oh, wow, you are now Alifiya on the Facebook. I can see this is now. Please post your questions here. Okay, guys. Please, guys, you can post your questions on Facebook. Dr. Srisha, Dr. Daniel, Dr. Lev, Dr. Natalie, Dr. Naoman, Dr. Thank you very much, Dr. Audible. Very good then. Okay, then for every one of you guys. Yes, please, Dr. Maylin, everyone. Hi, Dr. Daniel as well. Okay, Dr. If you can start right now, if you would like to start right now. By the way, guys, before Dr. Alifia starts, this session is very important, very, very important. There is no ADC exam without infection control, by the way. Hi, Dr. Lubus, how are we going? Alifia, I'm not quite sure if you start to talk or not, because again, I cannot hear you. But that's okay. If you talk, just keep going.
Alrighty. So good evening, everyone. I hope you all had an amazing day today. And I don't know which parts of the world are you all joining in from. So if it's evening, good evening. If it's morning, happy morning to all of y'all. And we're going to continue with our session on infection control today. Okay. So we did a few things last week. And of course, we couldn't cover a lot of topics, which we will try covering today as well. I'm not sure again if we have enough time because infection control is a very vast topic. So we'll see how much we can cover. I don't want to rush it so that you all don't understand things. We'll take it slow. Even if you all can learn one thing out of the session, you guys are a winner, right? Because even learning one thing out of a session can change a lot of things in your exam. Okay. So if you all have doubts, please put it on Facebook on the live session. Okay. And just give me a second. I think there are some questions coming up already. Um, okay, that's fine. So if you all have any questions, please put them on Facebook Live. I will try to answer them in between, but obviously I cannot read in between while I am focusing on the session, but I will still try to go through them towards the end. Okay. So let's start a bit of revision from last time of what we discussed. So the most important two things which we were discussing was firstly about the new guidelines, what ADC has come up with for infection control. Okay. So what they basically ADC is mentioning is that infection control is a very, very important part of your exam, and out of which hand hygiene is also very, very important. And that's what they're going to be seeing, or that's what they're going to be assessing you all on. So that's going to be very important for your, obviously, for any part of your ADC exam. Okay. I don't know if somebody is not on mute. If you all are not on mute, is it? I could hear somebody in the background. Alrighty. So we were talking about hand hygiene in the last session, and in hand hygiene, we spoke about.
Sorry, Alifiya, just I muted everyone right now, so you can unmute yourself again, please.
Yes. Thank you, Dr. Adam. So we spoke about hand hygiene last time, and in hand hygiene, there were two topics. One was hand washing, and the other was hand sanitizing. In hand washing, we went through all the steps. We also went through how many seconds we need to wash our hands as compared to if you were sanitizing. We also went through the difference between when we can hand wash or when we can get away just by hand sanitizing in our clinical practice or in our day-to-day practice. Okay. Because sometimes there's this confusion about, oh, is my hand sanitizing going to be enough, or do I really need to wash my hands? Okay. So you need to understand this concept, which we went through last time. If you all don't understand this concept still, you all can ask questions and maybe we can go through them later. But this concept should be very, very clear. It should be second nature for you so that you don't have to think. Like when you're working in the clinic, you don't think that, okay, should I sanitize or should I hand wash right now? It should just flow. The same way, this knowledge in your mind should just flow, be it in your part two or your part one exam. And that will make a big difference for you to clear in infection control as a criteria overall. Okay. Because hand hygiene, though it sounds like a very, very small topic, it's a very vast topic in a way that you need to have your concept very clear. Okay. So that was what um, we went through last time. Okay. So now we're going to go through a little bit extra or a little bit more. So there's one question on the screen right now about infection control. You all can read this question and see if you all can answer it. So which type of infection control precautions should a general dentist routinely apply on their patients? Is it A, B, C, or D? B, very good. So most of you all are saying that it should be B, right? So B is yes, it is definitely the right answer. So we need to always follow standard precautions, but we need to know what standard precautions are, right? So in infection control or in general dentistry, whatever we are doing on a day-to-day basis, we have to prevent infections, right? Our main goal is, because we are seeing patients day in and day out, we need to prevent that form of infection to pass from one person to another, okay, or even from patient to ourselves. So there are two different kind of precautions which we need to follow in order to prevent transmission. So one precaution is our standard precautions, okay, which are the work practices applied to achieve a basic level of infection control. So we need to ensure that we need to follow standard precautions on a day-to-day level. All right. And then we have additional precautions. So additional precautions are used for patients which are known, either you know or you suspect them to have an infection or a disease that can cause an infection in others in a healthcare setting. Okay. So if you know that the patient is not infectious or just a regular patient, you will still follow standard precautions. But if you know that a person has certain kind of disease or an infection, we need to go ahead with certain kind of additional precautions. Now, additional precautions, what are the things which are involved in additional precautions, right? So we want to avoid the transmissions which are caused by, one is the airborne transmissions, which is example is like tuberculosis or measles or those sort of things. So obviously in these kind of additional precautions, what are we going to try and do? When we are doing standard precautions, we are just using our regular clinically acceptable standard masks, right? But in case of additional precautions, in cases where there is an airborne transmission, you will use something like an N95 mask. So that's the difference between your standard precautions and what you would do in your additional precautions. Okay. Then the other kind of precautions would be obviously like building a negative pressure room or having certain isolation rooms. Okay. So all of these things can also be your additional precautions. The other kind of additional precautions which we want to avoid for the type of transmissions are the droplet transmission. Yeah. Now, what is the difference between our airborne droplet transmission and contact transmission? So there are three types, right? One is airborne. Obviously, we understand what is airborne. Airborne means it is passed through air, right? But how does it pass through air? Again, there should be some amount of droplets which go in the air and then that is passed on to somebody else. So that is called as airborne transmission. So the only difference between our airborne transmissions and our droplet transmissions is the size of the droplets of the infectious particles, right? So if the size of the infectious particles or the size of the droplets are less than 5 microns, then that will come under an airborne transmission, right? Because the small particles or the aerosols, which are often smaller than 5 microns, they are created during breathing, talking, coughing, or sneezing. And secondarily, by evaporation of the larger droplets in conditions of low humidity. Okay. So definitely your smaller particles, which are less than 5 microns, can be generated when a patient is probably breathing or talking or coughing or sneezing or any of these things, right? However, if we compare this to our droplet transmission, the difference between droplet transmission is that the particles are larger than 5 micron size, right? So the respiratory droplets transmit infection when they travel directly from the respiratory tract of an infected person to the susceptible mucosa. That is, so directly from a person to person, that kind of droplet is passed in direct to the person, right? And the droplet distribution is limited by the force. Obviously, depending on the force of which the droplet has come out from the infectious person, that and the gravity, that will determine of how much it is going to be transmitted from one place to another. Okay. And the other one is a contact transmission. Now, contact transmission, obviously the word says it, that it is contact. It happens with contact. Now, contact can be two types. It can be a direct contact that occurs when an infectious agent is transferred from one person to another. That is, example, like a patient's blood, which is entering into a healthcare worker's body. Like imagine you prick yourself, right? You prick yourself with a needle. So the blood of the person is gone directly into your blood. Okay, so that could be a direct transmission. Or sometimes it can be an indirect transmission. So indirect transmission can occur, that is, it involves the transfer of an infectious agent through a contaminated or an intermediate object or a person. Okay, so like if an infectious person goes and touches something, right, and then you go and touch the same thing, so that is obviously called as an indirect transmission. Okay, so we need to understand the difference between different types of transmissions so that we can avoid having these kind of transmissions in our day-to-day practice. Okay. So, however, in general dentistry, we will follow standard precautions for every patient. But if the patient is suspected or you think that there is a suspect, like either you suspect or you know that the patient has a particular kind of infection, which can either be airborne or it can be droplets, or it can be occurring through contact as well, then you might end up using some form of additional precautions. Okay, so let me go back to our standard precautions first. So standard precautions apply to all patients, including obviously HIV, hepatitis A, hepatitis B, hepatitis C, conjunctivitis, and herpes simplex, which is the most common kind of diseases which you would encounter in a dental practice, okay? Because we are dealing with blood and we are dealing with sharps, right? So these are the things which are most commonly seen in dental practices. And for all of these things, you have to apply standard precautions. So what does standard precautions involve? Obviously, it involves hand hygiene, right? Hand hygiene with all the movements, which I showed you last time. Then the use of personal protective equipments, which is very important. So in a practice, you have to end up having a gown, you need to wear a mask, you need to have your protective glasses. So having your mask, having your gowns, having your protective glasses is not additional precautions. That is standard precautions. That has to be done in any clinical practice. Okay. Then the safe use and disposal of sharps, which is another very important topic. And we might start with that topic about sharps in a bit after we've gone through these standard precautions. Okay. Then routine environmental cleaning, which is again a very important thing. After every patient, all the surfaces need to be wiped down, including your bench tops, including your dental chairs, including your cabinets. All of these need to be wiped down. So that's a routine environmental cleaning. Okay. Then reprocessing of your medical equipments or your instruments. So by this, we are talking about sterilization, autoclave, and all of these information. Okay. So all of this also comes in standard precautions. The next very important thing is your respiratory hygiene and your cough etiquette. Always in a dental practice or in a medical practice, you are advised to, if you cough, obviously you need to cover. And if you're sneezing as well, it should be a closed mouth sneeze, not an open mouth sneeze, to avoid the transmission of infection. Okay. So that is very important. And also, if you do sneeze, the most important thing is that you have to change your mask, which I see many people just continue if they sneeze or they cough. Coughing still, it's a gray line because how many times are you going to change your mask if you cough like multiple times, right? But again, when you cough as well, trying to close mouth cough and do not expel a lot of fluids from your mouth. And if you're sneezing, you definitely want to change your mask because you're not going to be sneezing constantly, right? The next is following an aseptic technique, which is very, very important. Aseptic technique meaning that you always have to have the flow, which is from your um, clean area to dirty area and then back to sterilization. Okay. And only from steady to clean and clean to dirty. Never the other way around. Never dirty stuff comes back to the clean area. Okay. Waste management, again, very, very important topic, waste management, because I understand that waste management can be different in different countries. It can be different in different states as well in Australia, right? So that can also be some kind of a doubt in our minds. There is a question, Maria is asking about facial shield, right? So yeah, facial shield, you could use facial shield. So either you're using a mask and a protective eyewear, then you might not end up using a facial shield. But if you're using only, if you're not using an eyewear, but you still have to wear a mask, and then you can put on your face shield. Okay, but the most ideal would be wearing protective glasses because that covers all the way to the corner of your eye. Okay. Waste management would be fine. Then going to appropriate handling of linen. Well, this doesn't apply much in dental clinics. That's more for hospital setting. And standard precautions should be used in the handling of blood, including dried blood, very important. All other body substances, secretion, excretions, regardless whether they contain visible blood, non-intact skin, and mucous membrane. Okay, so we still have to follow standard precautions, even if it's dry blood, even if it's any form of secretions from a patient's body, even sweat, right? Like you have to clean the chair after the patient is finished. Why? Because we are applying standard precautions. That's not an additional precaution. Cleaning the chair is still a standard precaution, where after every patient, because there can be some form of body secretions or touch from the body onto the dental chair, we do not want it to be transmitted to somebody else. And that's the reason that it has to be wiped down, and that still is considered as a standard precaution. Okay. So we went through standard precaution, we went through additional precaution, which was your airborne, which was your droplets. Of course, our normal flu would be an droplet transmission as well, right? Because your influenza viruses can be transmitted via droplets as well. And then we have our contact transmission, so that is done. Okay. Transmission-based precautions should be tailored to the particular infectious agents involved and its mode of transmission. This may involve a combination of practices. So it doesn't mean that if you're doing only contact precautions, you're not doing droplet precautions. You might be having to do both at a time, right? So contact precautions are used when there is known or suspected risk of a direct or indirect contact transmission of an infectious agent that are not effectively contained by standard precautions alone. So if you're ever in doubt that, okay, my standard precautions might not be helpful in this kind of a case because I know that my patient has a bit of an infection, which might not be controlled only by standard precautions. So you might end up using additional precautions, which is for your contact precaution. Okay. So you need to just think um, before you do a particular task that, okay, standard precautions, I'm going to definitely follow. But is this patient coming into any category where I might have to use additional precautions, like something related to contact or something related to droplet, right? So droplet precautions are used for patients known or suspected to be infected with agents which are transmitted over short distances by large droplets. So we already said that the droplet size was greater than 5 microns. And obviously, only if the patient is in that much close proximity to you, you will need to use those droplet precautions, because if the patient is really far, then those big micron sizes cannot be transmitted from one person to another. Okay. So maintaining your distance as well. Like suppose if you have a patient with maybe coming with flu, right? So you definitely are going to follow your standard precautions. That's normal. You're going to put on your mask. You're going to do all of that. But you might still end up having certain kind of extra droplet precautions by keeping yourself having a distance from the patient. That could be one additional precaution, right? Because you're maintaining that distance, because you know that that might be transmitted if there's a direct sneeze or something like that. Okay. And the other is like airborne precautions are used for patients known or suspected to be infected with agents which are transmitted from person to person by air, right? Airborne transmission, which we were talking about. So less than 5 micron size. Okay. So in these kind of cases, if you know that your patient is coming with tuberculosis or something like that, and it can be transmitted, your standard precautions, your normal mask might not be applicable. So in that case, you will end up using a mask which is probably like an N95 mask, or you might have to use a room with a negative pressure environment. So you might have to schedule your patients accordingly during the day as well. Okay. So that the cleaning, it becomes easier. So those kind of precautions you might have to end up using during your as an additional precaution as well. Okay. Now hand hygiene, we've already gone through, so I'm going to skip all of this part. Everyone on the chat on Facebook Live, do you all have any doubts with hand hygiene? Can you put it here quickly before I proceed to the next? From the last session, or even if you have any doubts in your mind, do you have any doubts for hand hygiene? That is for washing and for sanitizing. Lev, you said yes. Can you put in your doubt? All good. Okay. So I think mostly you all are fine. Okay, let's answer this question, everyone. There's a question on the screen. Simran asked the question saying hand washing only before entering and leaving, otherwise just alcohol-based hand rub. You're right, Simran. Hand washing should be there when you enter and exit the room. If you can see my screen right now, it'll change in a second. I know it's not visible to you all. So that is the rule about your hand washing. So yes, when you enter and exit a room, you will wash your hands. That means entering into any area or any surgical area. But the other time you will wash your hand is also if your hands are visibly soiled with saliva or blood. That means that you had a puncture in your gloves. So if you had a puncture in your gloves, then you have to wash your hands. And only hand sanitizing will not help. Okay, Simran, I hope that helps. Um, Dr. Lev said he is allergic to alcohol and alcohol-based hand rub. Well, good question. It's a good question to send to ADC. If you're in your Part 2 exam, then you need to email ADC that you are allergic to alcohol in the alcohol-based hand rub so that they can exempt you for that. But in clinical practice, honestly, I don't know what you'll be able to do. You might have to just wash your hands in that case. Hand scrubbing is not done anymore as it affects the skin barrier. No, you're not scrubbing your hands with anything. It's just with soap and water. You're not using like a brush to scrub your hands. Dr. Alifiya, in the patient's home, do we do hand wash or alcohol-based hand rub? Dr. Vanik, I did not understand your question. In patient's home, what does that mean? Like, are we providing home visit for dentistry? Is that your question? I will ask them after first positive result. That's good, Lev. So I assume that you're waiting for your results right now. Okay. Which will be in April this year. That's nice. All the best, Lev, for that. Some old age homes. Okay. So in that case, same, you're gonna follow the same thing. Like when you're gonna enter inside an old age home or if into a place where you're providing your services, because you're going from an outside environment. Imagine you're driving a car and then you enter into an environment which is surgical or where you're actually going to perform a task or you're going to start looking into patient's mouth. You will first wash your hands because you came from somewhere else. You were probably driving, you were eating, you were doing all of these things, right? So when you enter, you'll wash your hands. But in between, when you're wearing the gloves, if you're changing your gloves, you can just sanitize your hand. And obviously, when you leave that environment, now you're going to go back to your car. So you don't want to take all that infection with you, so you're going to wash your hands and then you're going to move out. Okay, so it remains the same. Do we still do hand wash before and after wearing gloves, or is it alcohol-based hand rub? It is only alcohol-based hand rub. Mintu, if that answers your question. You do not have to hand wash every time you wear gloves. Herpes simplex, no, you're still going to do standard precautions for 1 week. What more precautions would you do in herpes simplex virus? Okay, I don't want you all to confuse yourselves. Where you're going to hand wash and where you're going to sanitize is pretty clear. Whenever you are entering inside into a surgical area, you're going to wash your hands in the beginning and at the end. In between, you can always sanitize your hands, okay? Because you're already into the surgical setup. Like imagine if you see 10, 15 patients in a day, are you going to wash your hands like 15 times? You're not going to do that, right? Like after every patient, your patient goes out, and before you get another patient in, you're going to wash your hands again. And then when you go to drop that patient out, you're going to wash your hands again. You're not going to do that. But in the morning, when you come into your practice, you wash your hands once, and then you see all your patients throughout the day. Before you go for lunch, you wash your hands. And then after you come back from lunch, you wash your hands. And then at the end of the day, you wash your hands. Okay. Alrighty. So I'm going to move forward. So for this, you'll answered B, right? Which of the following situations does not require immediate hand hygiene according to current dental infection control standards? After removing a dirty tray from the treatment room. What? Did you all answer B for this? It's not B, right? C. Yes, C is the answer. Because which of the following situation does not require immediate hand hygiene according to the current dental infection control? So if you adjust after adjusting a patient's mask, obviously you're not going to adjust a patient's mask, it might be your mask, right? After removing a dirty tray, you have to. And after touching your own mask or eyewear during a procedure, you have to. That's good. Okay, so what was B then? Which of the following factors most significantly affect the efficacy of alcohol-based hand rub in a clinical dental setting? The frequency of use, the types of glove worn afterwards, the volume used and thorough coverage of hand surfaces, or whether it is fragranced or not. What's the answer for this? The answer for this is C again. Okay. It doesn't matter how many times you're using it. It matters whether you've taken the right amount. And that's what we were talking about soap and in hand washing as well. Remember, I was showing you all from Hand Hygiene Australia, the website, where they say that it is very important to take the right amount of soap, which covers all the surfaces of your hand and not just a quick or the right amount or right volume of sanitizer, which will cover all the surfaces of your hand. It's not about only your like quick motions. It's about taking the right quantity and then doing all those steps for those many seconds. If you do all those three things, only then your hand hygiene is effective. Okay. Now there was one question about what about adjusting the light on the loops, putting the yellow filter for composite filling, only alcohol-based hand rub. Okay, Nidhi, that's your question. So if you're telling me that you are going to adjust your headlight, the filter, okay, and then you're saying you're going to do just alcohol-based hand rub. But what are you going to do before and after that? You're going to remove your gloves, right? So, yeah, if you have decided that you want to adjust the filter on your loop, so first you will have to remove your gloves. You will have to sanitize your hands because that is always a rule, right? As soon as we remove our gloves, we sanitize a hand. And after we sanitize a hand, you can probably grab a tissue just to flip the thing down, your orange filter, onto your loop. You chuck the thing in the dustbin, the tissue. Then you're going to sanitize your hand once more, and then you're going to put your gloves on. You don't need to wash in between here. Okay. And can we have, Hussam says, can we have a scenario about a dropped instrument? Yes, we can go through that scenario about a dropped instrument. Just give me 2 minutes. After touching patient's mouth, Sangeeta's question, after touching patient's mouth and touching the sterile instrument, is it a breach in sterility? As we use the same instrument for the same patient, what is this classifies under? After touching patient mouth and touching the sterile instrument, is it a breach in sterility? As we use the same instrument. Sangeeta, your question is not very clear. I'm sorry, I can't understand it. Can you rephrase it? Because you're saying that after you touch a patient's mouth, but you're touching the patient's mouth with what? And then touching the sterile instrument. Can you rephrase your question? Take your time, write your question again so that we can understand better. Dr. Shiva, that's right. So you remove alcohol-based hand rub, adjust, but adjust with a tissue. That'll be nice because if there is any splatter onto your loops when you're working, then you don't want to touch that with your bare hands as well, right? So you just want to, as a precaution, just use a tissue or something in between and then do that. We cannot use a gauze. Um, you could, but you know what would happen? If you use a gauze, the examiner might think you used a dirty gauze as well, right? Because you have gauze on your bracket table, and they might think that you use the dirty gauze from the bracket table. They might not know that it's a new one. Okay. So the best would be tissues because tissues are not something which you keep on your bracket table just as is. Dr. Shiva Sharma, re-glove the same glove or new gloves? No, Simran, you always have to wear new gloves. Once you remove the gloves, they go straight in the dustbin, right? You cannot remove the gloves and put it somewhere and then re-glove the same glove. No, because when you're trying to do that, there's a lot of blood and saliva onto that glove, and you might end up putting that saliva and blood onto your hands. Okay, so there's no way. The minute you remove the gloves, you have to throw it in the dustbin, and that's why this habit has to be built at home because at home you're trying to save gloves, right? Because you're like when you're practicing, you're like, okay, I'm just going to use the same glove for now. So sometimes you end up using the same glove, and that happens in the exam because that becomes a habit. So you cannot do that. Even at home, when you're practicing, ensure that you're changing your gloves and you throw the glove immediately. Because why I'm saying this is because if this happens at home, you might even end up continuing to work if your glove is torn or punctured and you won't even know. And the same thing will follow in the exam. Okay. And it's very, very important that your glove is not punctured or torn, and then you're constantly working without even noticing that. Mintu says, could we adjust the loops with gloved hands and disinfect the loops post procedure? No, you can never do that, Mintu, because imagine that you're doing an extraction and your hands are filled with blood. Are you going to do that? Like, are you going to touch your loops with that blood of a patient? No, you're not going to do that. So, these personal protective equipments, like loops, are considered dirty, but they're considered to protect you. So you're not going to intentionally go and put some more infection on top of it. Okay. So they are there to protect you from any kind of splatter or any kind of aerosols and all of that. But you're not going to intentionally go and put some blood on top of it by touching it. Okay. So that's not allowed. Parmisa says I actually pass infection control in exam few times using gauze. That's very good, Parmisa. If you've done that and if you've passed, well and good. But if you think logically, you might have had an examiner which might have been okay. Tomorrow in another exam, there might come another examiner which might not be okay, right? So you just want to try and be safe as much as possible. Okay. There are some people, like I'll give you an example. There are some people who never use a tweezer to remove the burrs from the burr box, and they have passed infection control, right? But there are some students who did that, and the examiners actually come and told them that are you using this without your tweezer, or are you using hands to pick up the burrs? So you don't know. It totally depends on the examiners as well. So as much as possible, avoid. I understand it's an exam. There are certain things you can't. There are certain things like there's a flow of things which you're doing it with. So if you really can't manage it, then just do it. Um, Try to bend the rules a little, but you can't just break the rules. So you need to just try your best to stick to them and see how you go. Okay. Just a detergent disinfectant. If you're talking about loops, Simran, about detergent disinfectant, then every loops or every protective glasses which you have good quality ones, they'll always have certain instructions which you can use, like certain kind of loops you can't use detergent wipes, certain kind of loops you can use only like alcohol wipes. So there are many kind of instructions which different kind of instructions which the company would give you, so you need to follow that if you want to maintain the uh, longevity of your loops or the quality of your loops. But for your ADC practical examination, I don't think they're that fast that what you're using, detergent wipes or alcohol wipes. You can use alcohol wipes as well, whatever they're giving you in the exam, like a alcohol wipe. Additional precautions, contact is gown plus surgical mask is droplets, surgical mask or N95, airborne is N95. Yeah, that makes sense. Herpes will be only standard precautions. You could add contact precautions in there, but your contact precautions will be those only, which will be your covering most of your standard precautions. Okay. Jillian said that I've missed a question, so let's go to Jillian's question. Jillian said, so for loops, we remove gloves, then hand wash, then sanitize. No, Jillian, you don't have to hand wash. So that's why I'm saying your concept has to be clear. You cannot have these doubts in your mind, right? When did we say we hand wash? We said we only hand wash when we come inside a room, surgical setting, and we go outside that surgical setting. Or while you're working, your gloves have like punctured, or there's a hole in your gloves. So there's a direct contact of saliva and blood onto your hands. Only then you wash your hands. Otherwise, you don't really need to wash your hands. So when you're doing your loops thing, what I would recommend is you sanitize your hands and then maybe just take a tissue and just flip the filter down and then just sanitize your hand again and then wear a new glove. You don't have to actually wash in between. Okay, Mlizma says dropped instrument being replaced, right? So she said that if there is an instrument which is dropped on the floor, how would you manage it in a clinical setting? So if you have an instrument which is dropped on the floor, obviously the first thing, you stop working, right? Don't just ignore the instrument and push it with your leg here and there. You stop working and try to manage that instrument ASAP. Unless you're into a very tricky procedure where you cannot leave the patient. So, like, whatever, imagine any tricky procedure where you feel that no, I just can't leave the patient right now. And if your instrument which you've dropped is not sharp, then you can just push it slightly on the side. Okay. So you pushed it on the side, that's fine. But if you can, first you need to attend to that instrument. So what we will do in that case is the instrument is on the floor. I will obviously remove my gloves. Yes. Then I will sanitize my hand. I will retrieve with clean hands the new instrument. And then I will alcohol base rub and the new gloves or retrieve instrument with sterile tweezer. Okay, Mlizma, you're talking about retrieving the instrument from the floor, or you're talking about retrieving a new instrument? You tell me that first, then I can answer your question. Because you said retrieve the instrument with clean hands. Now, if it is from the floor, then you can't do it with clean hands. If it's from the drawer, then yes, you can do it with clean hands. Do we wash hands routinely after exo if hands are visibly clean? Depends on if it's a surgical extraction. Okay. For just your regular extractions, you don't really need to. But if it is a surgical extraction, then yes. But as a general dentist, when you're just doing regular extractions, where you're not actually doing a surgical setup, where you're not draping the patient, you're not drilling the bone, none of these things, then you don't need to wash your hands. Assistant unpacked sterilized implant abutment and accidentally dropped it on the floor. What to do? How to sterilize the abutment? Do we need to sterile through autoclave cycle? Yes, you cannot do anything else apart from actually sterilizing the tool. Okay. So anything which drops on the floor, if it is a reusable item, it has to go through steady. There's no way we can disinfect it with anything else. If it is not an item which cannot be sterilized or cannot be put into an autoclave, that has to be discarded off. So, Milsma, if you said it was retrieving new instrument, then whatever you said was right. Isn't head cap considered a part of PPE? Yes, head cap is considered a part of PPE, Asanka. If you want to wear a head cap, that's fine. After extraction, there's visible blood on gloves, but none on hands. So just alcohol-based hand rub. Yes, that's right, Kalender. That's right. How to manage the instrument on the floor? We already discussed that, Sandra. I think Mlisma has already spoken about that, so just go and see her comment. Shiva, I don't understand your question. It says droplet is surgical or N95. I'm confused or either. Do you mean that a patient with a suspected um, droplet transmission? Is that what you're trying to say? Droplet will not, I don't think droplet is N95 because it's greater than 5 microns. It would be the regular mask. What mask to use if doing simple extractions with patient with COVID-19? Standard precautions. I think you're a bit confused. Let me go back to that slide. Okay, so for airborne transmissions, you all are using N95 masks. Okay, because the microns are less than 5. For your droplet transmissions, because they're bigger microns, a normal face mask, a surgical face mask is acceptable. All right. And for contact, obviously, contact is because of contact, guys. It's not because of air, right? It's because of the physical touch, like you're touching things. So you have to be proper gowned up, you have to have proper gloves, and then you have to clean, like clean the doorknobs. If the patient is entering and he's opening the door, that you need to clean. So that's contact. Simple. Is that clear? Now, Jillian, your question. So in COVID-19, which mask? Ideally, it is in COVID-19, you can use an N95 mask, okay, because it depends on the micron size as well, right? So you could go with your airborne transmission because that's passed through airborne. Okay, so you go with N95. Okay, but imagine if your patient comes with a regular flu, okay, just a normal flu, he's sneezing a little bit. Would you mask up with N95 mask and stuff? Or if your assistant has a flu, she's come with coughing and runny nose and stuff. So you're not going to just sit and put N95 mask and everything, right? Because then that is just comes under normal droplet transmission, influenza virus. Okay. And if your patient has COVID positive, you ideally would not even see them. You want to move them to another day unless it's an emergency. Okay, let's go, guys. Let's go ahead. That's a lot about these precautions. You'll have understood quite clearly now. No? Why, Simran? Why do you say no? Simran, what do you mean by no? No? Everyone's saying no. I don't understand what is no. Yes, that's right, the tummy. Okay. Umair's question is there is an order of doing hand hygiene, picking up mask and put on PP and removing everything. Can you please elaborate? Okay. Umair, we can go through that. Okay. So his question is that he wants to know the sequence of what all things we need to do. Okay. So the sequence is obviously imagine you are entering inside your clinic. First patient in the morning, 8 o'clock. Okay. You went entered inside the room. So obviously because you've come from outside, you will first enter inside your clinic space. You wash your hands. Okay. So you wash your hands, you're ready for the first half of the day. All right. So you washed your hands and then your nurse has arranged everything or whatever. Or if you also need to arrange everything because you wash your hands are clean. You can touch all the clean area, you can pick up all the instruments, whatever you want, and you can arrange them for your patient. Okay, now once the patient comes in, you will obviously put on your gown, which will remain the same for the entire day. You don't have to change your gown after every patient. So you put on your gown. Once your gown is ready, then you're going to put on your mask. After you put on your mask, make sure that you breathe in and breathe out a few times so that you can see that your mask is adjusted properly. So always have your mask adjusted to the bridge of your nose, and it should be extended all the way below your chin. Okay. You cannot have your mask not extended below your chin. Even if you have a beard, it needs to go all the way down under. Okay. After you've put on your mask, you will put on your eyewear. So once you put on your eyewear, either your protective glasses or your loupes, you put that on. After you put that on, again breathe in and breathe out a few times, because when you do that, you will realize that your eyewear is fogging. That means that your mask is not fitted properly. So you remove your eyewear again put adjust the mask, breathe in and breathe out a few times. And then once you're fine with the eyewear, no fogging, then you will sanitize your hands once, you'll put on your gloves, and then you will start working. Okay? So that would be your sequence. Okay. Umar, I have seen your question and I've answered it. I hope that helps. Okay. Anyways, we're going to go through next few slides in the next sessions as well, which will cover. Let me go through the next slide first. Can we have, as a dental profession, can we have any form of nail polish on our fingers? Even if a clear nail polish, is that allowed? Yes, of course, Kainat, that is a good thing that you will change your gown in contact and transmission-based precaution patients. Okay, so Melisma says nothing on nails is the best. Yes, it's not only the best, that is a mandatory. Okay, in your dental practice, you cannot have even a clear nail paint. All right, so that could be your question, that you can't have it. Forget artificial nails, forget colored nail polish. You cannot even have a clear nail polish, so you can't have anything. Your nails have to be just clean and natural. Okay. All right, personal protective equipments we have already spoken of. So there are different kind of gloves, guys. Personal protective equipment. There can be sterile gloves, and then there are non-sterile gloves. The one which you'll use for standard precautions are just your um, non-sterile gloves, which you use in regular dental practice if you're not doing any form of surgical procedure. Okay, and these are the things which you have to remember about your gloves and about your mask. And I think all of this we'll have to cover in the next topic because there's a lot to cover for this. And we already have only 3 minutes for Dr. Adam's session. So I'm just going to quickly go through a few more questions and then we can cover all of this in the next session. Sangeeta said this is an alpha genius question. Accidentally touching a sterile instrument with gloved hand after contacting the patient mouth. What is the most appropriate step? Okay, that's what you're saying. Accidentally touching a sterile instrument with gloved hand after contacting the patient mouth. What is the most? Continue using instrument as patient is already exposed. Discard instrument and replace with new one. Notify breach to the patient and seek consent to continue. Touching a sterile instrument with gloved hands. Contacting the patient's mouth. The question still doesn't make sense to me, but if that it is what I think what it is, I would say discard the instrument and replace with new one. But that if you're talking about a sterile instrument, why would you discard that instrument? But then the continue using instrument as patient is already exposed. What is the patient exposed to? I'm not understanding this question. Ask Dr. Adam this question if it's a part 1 question. He might be able to explain better. Simran, when to apply hand cream? Is it mandatory? Not really. It's not mandatory to apply hand cream, but whenever your hand is dry, obviously you have to apply hand cream in order to prevent dermatitis. Bare below elbow. So donning will be hand hygiene, gown, mask, eye protection, hand hygiene, gloves. Melisma, very good, but instead of hand hygiene, could you write hand wash and hand sanitizing? Because that can confuse people. Because hand hygiene is both, right? Hand washing and hand sanitizing. Glove, gown, eye protection, mask, hand hygiene. In donning off, you can also do deglove, sanitize, then remove your eye protection, then remove your mask, throw that. Then you can remove your gown and then you can wash your hand as well. So that also can be right. Okay, but just write it as hand wash separate and hand alcohol based rub separate. Okay, it's 8 o'clock sharp. I won't let Dr. Adam wait for his session. So I would say we can continue with the infection control session for the next time, where we have to cover a few things about clean area, dirty area, and we need to cover sharps, which is another important topic. Then we have to cover waste management as well. So yeah, we might take a few more sessions to cover these things. Okay. All right, everyone. Thank you and have a lovely evening and enjoy Dr. Adam's session. Dr. Adam, are you here?
Yeah, thank you very much, Alifiya. That was very great.
Thank you, Dr.
Thank you
Adam.
very much. Thank you.
I will see you, everyone, hopefully next week or the week after. I'm not sure. The admins in the academy will organize a session soon. And
Most probably, Alifiya will be this week, or I will let you know, okay? We're gonna organize it, let you know, because exam for part 1 is this Wednesday.
yeah, all the best, everyone, for your exams
Thank you.
as well for part 1.
Okay, thank you, Dr. Alifiya. Have a great night then.
Thank you, Dr. Adam.
And now I'm with my candidates again, my champions again.
That's good.
Thank you.
Thank you.
Okay,
Bye-bye.
guys, all my champions. So we are here right now. We're going to discuss questions, very important questions, and new questions, and their answers. Also, some questions, some topics, I expect them to be in exam. So that's what we're going to discuss as well. I see September candidates, they actually in rush. So it's good to start right now. But please don't be stressed at this stage. The people really they need to be stressed. The candidate they go on exam next week, not you. So please don't be stressed. Yes, you can start. And actually that's what you do. Like all September candidates, they already enrolled to this course. They go all the materials. But don't be tough on yourself. Just to only attend the sessions. Write down the notes, what we discuss, keep it for yourself until we start until we just start with you after we finish this course. Okay, guys, I believe it's much better to move now to the private link. Okay. Thank you very much, guys. All my champions, please move now to the private link. Thank you very much. Have a great night, everyone. But my candidates, they will have a great night with me. They cannot go. Thank you very much, guys. Please, guys, ensure you join the private link. Thank you. I see some people, they sign out from here and then they sign back in. Okay, guys, private link, please, guys. Okay, not this link.